To get a CT scan done in R. Damansara Medical Center, first, you need to visit your clinician and get a referral form or letter, hand it to the imaging department at ground floor. Then you'll be scheduled for an appointment. What is CT scan? CT scan is computer tomography, which is also known as CAT scan or CT. It is a big camera in a donut shape, which looks like this. It has a long table that carries the patient towards the machine. The X-ray tube will move 360 degrees around the patient and capture images. The radiologist is a doctor that will do the reporting for you. Before the examination, we need to check your name, date of birth, patient ID, confirm it is the correct site and procedure to be carried out. For female patients, we need to know your first day of your last menstrual period to confirm you are not pregnant. If you are pregnant, please let us know. You need to change into hospital gown, remove all valuables including your dentures, and keep it in a locker. There is a diagram to teach you how to change. Our nurses will check your blood pressure, heart rate, and oxygen level to confirm you are suitable to proceed with the scan. There are two types of CT scan. Plain CT is a scan that does not require any injection of contrast media and takes a shorter time to finish the scan. Contrast enhanced CT is a scan that requires injection of contrast media and will take a longer time to finish the scan. Before we proceed to the contrast enhanced CT, we need to check some of your medical history, including any allergies to seafood or medication, asthma, hypertension, diabetes, gout, and high fever. Some patients have allergies to this iodine-based contrast media that's given during the scan. We call this contrast adverse reaction. In mild reaction, you may have symptoms like nausea and vomiting. Moderate reactions, you may have swollen eyes, itchiness, and rashes. If it's severe, it may cause shortness of breath, chest pain, and kidney failure. If a contrast media accidentally leaks out from the injection site to the surrounding tissues, it will cause discomfort, swelling, and pain. This is called extravasation. You may need to undergo treatment to resolve it. The chances of having it is low. We also need to check your kidney function level with the serum creatinine result in the blood test. It's to ensure your kidneys are functioning well to excrete the contrast media out of the body. You will be asked to sign a consent form after you have understand the risk and the flaw of the procedure and to acknowledge you are willing to proceed. There are three types of contrast media may be given before or during the scan. First is the rectal contrast, which is inserted through the anus into the rectum and large bowels. It is usually applied on abdominal and pelvic scan. Second is the oral contrast. You'll be asked to drink a few cups of the oral contrast. They taste like mint, and you will go all the way from your mouth to the esophagus, stomach, and lastly at the small bowels. Lastly is the intravenous contrast injection. We will need to put a needle in the vein on your arm and contrast media will be injected through the needle into your body. It will highlight your heart and the blood vessels. The patient position during the scan could be head first or feet first. Instruction may be given in certain scans. The radiographer needs to check the images before letting you out of the scan room. After the long fasting for contrast enhanced CT, now you are allowed to release your diet. We need to keep the intravenous line for more than half an hour for observation because some of the patients may have late allergic reaction. You are also asked to drink plenty of water to excrete the contrast media out of the body. We will be happy if you could fill out a feedback form for us. Your suggestion is much appreciated. Thank you very much for your attention and have a pleasant day.